All right, welcome back, everybody, and welcome if it's your first time here. We are going through a little bit of a neuropsychiatry series. These are just short snippet videos of just learning a little bit of an overview of what's happening in the brain when it comes to different mental health conditions, as well as what's also happening specifically when it comes to looking at how medications are going to basically impact the brain in that way. In general, when you think about depression, think about certain areas of the brain being affected more than others. And in one particular brain region is going to be the prefrontal cortex. As I mentioned before, neurotransmitters are those chemicals that control the actions of the neuron. The neurotransmitters are the messengers that tell the neuron essentially what to do, right? And so an imbalance of specific neurotransmitters like serotonin is going to influence the activity in the brain, which is going to lead to some behavioral changes for the person. These are the serotonin receptors. They tend to correlate with feelings of either good mood or being happy and different things like that. In depression, and people that struggle with depression or have depression, not all of the serotonin molecules are binding to these receptor sites. You have a neurochemical imbalance in terms of what's taking place in depression. And this is why it's really important to reduce the stigma of mental health disorders, because so much of it is not even a person's fault. And so if they're not binding to the postsynaptic cleft, there's going to be less reabsorption in the presynaptic cleft, which is going to mean that there's less electrical signaling that's happening, that's moving across the cleft and down the postsynaptic neuron. And so we're going to see a lot of changes, especially with someone who's dealing with depression, where there's a serotonin imbalance within their brain. Okay, so as I mentioned, right, you have these SSRIs. These are going to be these red molecules that are depicted here. And what are these SSRIs going to do is that they're a class of antidepressant medications. And what they're doing is that they are blocking the reuptake of serotonin on presynaptic neurons. So let's take a little bit of a closer look at this, and then we can see what's going on. So you're having the SSRIs essentially block, or they're going to bind to the serotonin transporter. You can think of it as like a tunnel system where these neurotransmitters are going through. The SSRI is going to bind to that transporter. It's blocking the reuptake of serotonin on the presynaptic neuron. Therefore, what that means is that it's resulting in way more serotonin molecules available to bind onto the postsynaptic neuron. All right. So hopefully that kind of makes sense. You have this SSRI, it's going to bind to that transporter. It's going to block the reuptake of serotonin that is going to usually come back through that transporter into that presynaptic cleft. And by blocking it, that means that there's way more serotonin in the synaptic space that can therefore then bind onto the postsynaptic neuron. And then lastly and finally, we're going to get a situation where, because there is more serotonin that therefore is increased in that synaptic cleft, when you look at the prefrontal cortex, the antidepressants are increasing activity in that area of the brain. This is going to help to alleviate some of the depression symptoms. All right, so that was a little bit of a brief overview on depression and how it looks like in the brain.